Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Papanos and Romana Brennan.
Hello, everyone, and welcome to Nourish MD. Today, we are joined by our very own Dr. Weiss, and he's going to be talking about heart health and our cardiovascular system. Thank you, Dr. Weiss, for joining us.
Well, thank you for having me.
For those that have not listened to our introductory episode or maybe new to Nourish MD, can you just provide us a brief introduction of who you are?
Well, as obvious, I'm a physician. I graduated from medical school in Boston in 1980, did training there, and came to California in 1984. I went to San Diego, did some training in pulmonary medicine, which is lungs, and moved up to Orange County in 1986. And that's when I met Dr. Van Meter, and long story short, we started PPMA in 2003.
Wonderful. Fantastic. And in that time that you've been here at PPMA with Dr. Van Meter, what are some of the most common cardiovascular conditions that you've seen among your patients?
Well, heart disease is still the number one killer in the United States, unfortunately. And I'm sure we'll get into it, but, it is treatable. And we, meaning the medical community, has done a good job over the past, say, 40, 50 years to decrease the number of deaths of cardiovascular disease, which is still huge. Hypertension, which is related, which means elevated blood pressure. But the most important one is the hardening of the arteries, atherosclerosis, and that's so important because that's what we can really impact, especially with your health.
And diet and lifestyle. Can you touch on just very briefly what is happening in the body when the arteries are hardening? Can you just explain more about what that really is?
So you want your arteries. Now, don't forget, the blood travels through the body. It goes from the heart to the organs in the arteries, and then it goes back in the veins. I'm not talking about the veins. So we're talking about the arteries. And what's important is the innermost lining of the arteries. That's where the action occurs. And if there's some type of damage, and the damage can occur, for example, by constantly elevated blood pressure. If you go out and you run a mile and your blood pressure goes up and then it comes back down, that's not what I'm talking about. I'm talking about somebody who has persistently elevated blood pressure that can cause damage to the lining of the artery. That's one important cause. Certainly cigarette smoking can do it, stress or sleep, and also elevated blood sugar, like, people who have diabetes, or even just before they get to diabetes, it can cause it. And cholesterol, elevated cholesterol. Those are probably the main things.
And generally, when patients go to the doctor or here at PPMA, they will have a physical each year. And generally, a lipid panel is traditionally part of that blood work. And maybe you can just talk a little bit about some of the alternative lipid markers that can be looked at beyond just traditional cholesterol or triglycerides.
So most people don't realize this, but the standard lipid panel that I think you referred to is basically four numbers: cholesterol, HDL cholesterol, which is traditionally the good one, LDL cholesterol, which is traditionally the bad one, and triglycerides, which you mentioned. And the LDL in that panel is actually not measured. It's calculated from the other three. And that tool was developed, I believe, in the early 70s as a research tool, and it was never meant to be used clinically, which we all do. And the total, as I tell my patients, the total cholesterol number is the least important number. It really doesn't mean anything. HDL is important, but the LDL is also very important. I'm not saying more important, it's equally as important. And what we've learned is that the total LDL that's in that lipid panel is really not that important, because, and this is where we get into the additional tests, we can do what's called an expanded lipid panel, where we break down the LDL cholesterol into its component LDL parts. And that is when we can really begin to understand if we're looking at something that is potentially damaging to the arteries, and we can also, that also gives us other information. One of the tools we have is we look at the expanded lipid panel, and that gives us additional information. Most importantly, it gives us several numbers, like the total number. LDL travels around the body in little particles, so we can look at the total number of particles, or LDLP. And we also break the LDL down into its component particles, and we can see if it's the type that might be causing damage to the arteries or not. And there's other things that we can look at, like something called Lp(a), which can also increase your risk for heart disease. That's something that is genetic, so you basically either have it or you don't.
Health challenges can feel overwhelming, but expert home care can bring peace of mind. With PPMA at home, you get access to trusted professional caregivers who provide skilled nursing, therapy, wound care, and more, all in the comfort of your own home. Recover faster, feel supported, and stay connected to your physician and care team with 24/7 communication. PPMA at home, because healing happens best when you're where you belong. Call today to learn more.
And continuing this conversation of cholesterol, do you find that the level of dietary cholesterol has a direct impact on this blood cholesterol?
So I think what you're asking me is, if I eat cholesterol, is that going to negatively impact my cholesterol level? Well, that, I'm old enough to know, to have lived through the whole don't eat eggs because egg whites have a lot of cholesterol. And people, people almost put the poultry business out of business. But the reality is that's not the case. What you eat does not really affect your total cholesterol. Here's the way I think about it. The way the body handles cholesterol is primarily made and metabolized in the liver. And the liver dumps a lot of it into the bile, which goes into the gut, and then the gut reabsorbs it. So if you eat some egg yolks or whatever source of dietary cholesterol, that's additional cholesterol that's already in the gut, and the body's dealing with it the same way. And eating it does not necessarily elevate it, which means avoiding it does not necessarily lower.
Yeah, I believe the statistic is that diet can only impact that total cholesterol by up to 30%. That 70% of it is going to be made and controlled by the liver regardless. So adjusting your cholesterol intake in your diet is what you're saying probably isn't going to move the needle that significantly, right?
Right.
So you mentioned, though, that diet can be really important for atherosclerosis and preventing some of these really serious issues like high blood pressure. What are more important aspects that you like for patients to look at that aren't just modifying their cholesterol intake?
Yeah, great question. So I think the number one thing is carbohydrates, and carbohydrates comes in many different forms. The worst form to eat is a simple sugar, like candy. But you can get carbohydrates in vegetables and fruit, in bread, potatoes, rice, etc. And it's not well known, but the reality is if you increase your carbohydrate level above what your body's needs are, it eventually is turned into the bad type of cholesterol. And that's so I always, if I want somebody to alter their diet to lower cholesterol, I always focus on the carbohydrates and limiting the carbohydrate, which, can be very difficult for people to do. I mean, we evolved wanting to eat carbohydrates, and people don't necessarily know this, but if you eat some candy, you enjoy it. And the reason you enjoy it is you're stimulating the exact same area in the brain that cocaine does. And so you can get it, people say I'm addicted to sugar, and the reality is they are. And breaking that addiction can be uncomfortable. When I try and get people to stop eating sugar, I tell them they're going to hate me for at least 4 days.
At least.
Well, it can take up to 6 weeks to really change your physiology. In my experience, most patients can really change their physiology in 2 to 3 weeks.
Certainly something that Lauren and I have experienced being dietitians, and something that we counsel patients through quite often. So definitely have experience with that as well. Taking it back to the serum cholesterol, the cholesterol that's measured in the blood, is an elevated cholesterol something that absolutely needs to be treated? How do you approach someone's care when you see these levels? What are you evaluating to then determine how to proceed with their care?
That's a great question. So if you look at the studies, again, who cares what a number on a piece of paper is? I don't care what the cholesterol is. What I care about is preventing the bad outcomes. And in this case, we're really talking about heart attacks and strokes, right? If I'm sitting in a room with a patient and I know that no matter what we do, they will never have a heart attack or stroke, I wouldn't even check their cholesterol because it wouldn't matter. But of course, we can't predict, we can't know the future. So we're working with odds. And the reason statins are so widely prescribed is because they do reduce the risk for cardiovascular disease, for heart attacks and strokes. And but if you look at the data, and every cardiologist will agree with this statement, it reduces the risk for heart attack by like 35%. Well, that means 65% of the people are still having heart attacks or stroke. So there has to be other things that we need to deal with. And the question in my mind is evaluating the patient's risk. In other words, I have a person sitting in front of me. What is that person's risk? And there are other things that we can do to evaluate the risk. We can look at the family history, for example. If somebody tells me, they have parents and a sibling who's had an early heart attack or stroke, that's a major red flag. If they tell me, yeah, I've seen other doctors and we've always had trouble getting my cholesterol in line, that's a sign that they may have what we call familial hypercholesterolemia. If they tell me that, many of their relatives have a history of elevated cholesterol, that also may be an indication that there's familial hypercholesterolemia, and those people are at higher risk and therefore need to be treated more aggressively. But if I am somebody who I don't think has familial hypercholesterolemia and they have an elevated cholesterol, what's the risk? Well, then we may do additional tests, like what's called the CIMT, where they look at the lining in the carotid artery, or we do a coronary artery calcium score and see if, they don't have disease going on, then their elevated cholesterol doesn't necessarily mean anything bad for them and should probably not be treated. So it's all about trying to figure out what is right for the individual person.
Absolutely.
And you mentioned high blood pressure being something that is also dangerous for someone to continue to live with untreated. What are some measures that someone can implement through diet and lifestyle that may be able to help with blood pressure?
I think number one is exercise. Sorry, not diet.
It's okay. That doesn't fix everything, right?
I really believe diet's less important. There, certainly limiting salt intake can help, although it's probably less important than initially thought, say 20, 30 years ago. It's probably more important for people who are African Americans than other demographic groups. Why is that? I don't know, but it is. Studies have shown that. So the most important things to control blood pressure, in my experience, are exercise and weight loss. So if you can get them to lose weight, that's where the diet comes in. But the type of food they eat will not directly affect their blood pressure.
Great. Yeah. And exercise is something that can help significantly with that. And maybe even not so much sodium restriction and decreasing their salt intake, like you mentioned, but maybe even focusing more on just eating more potassium and just eat more plants to be able to offset some of these impacts.
I am a huge fan of a plant-based diet. So many benefits. And, eating more potassium, yes, but if somebody has kidney disease, that may not be the best option. So again, you have to tailor care to the individual.
Sure. Everything's individualized.
Absolutely. When it comes to lifestyle nutrition, we can really personalize the plan and care plan for every individual. So
absolutely.
I think we all can agree on the fact that is of utmost importance. So if for anyone who's listening who maybe is not already a patient of PPMA, where can they find out more about you, the other doctors at the practice, or how to become a patient?
Well, so I'll go old school first and give you the phone number, 949-566-8179. Somebody will pick up the phone and be able to answer the questions. Or the website is www.privatemds.com.
Wonderful. Well, thank you so much for your time.
All right. Thank you.
Right.
Thank you.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.